Hi, I'm Dr. John Lundgren, and I'm a board-certified endodontist. What I'd like to do is describe the process of a root canal to you. When I see a patient in my office, we go through a very thorough diagnostic procedure, and once we've made the diagnosis, then I sit and talk to my patients about what a root canal is. This is a picture of a healthy tooth. There are three main parts to the tooth. There's the enamel, that's what you see when you smile. It's very dense. The second underlying layer is called dentin. It's a very porous structure. It's got microtubules that bacteria can work their way down into the final layer, which is called the dental pulp, which is made up of nerves and blood vessels. This is very important for development of the tooth. The tooth develops around the pulp, and when it's finally developed, it's basically a remnant of development. And when you bite into, say, a cold ice cream sandwich, you feel that cold in the tooth. That's the nerve that you feel. So there are two main reasons why we do a root canal. Both reasons are caused by bacterial invasion of the tooth, and the side on the red side is called irreversible pulpitis or inflammation. Irreversible means it's not getting better. This is the hot tooth. This is the tooth that cold, hot, chewing, touch. This is the one where you wake up in the middle of the night and your heart is pounding in the tooth. That's not going to get better, and eventually, if we don't do a root canal, it will turn into an infection. Infection is the nerve dies, and the pulp chamber is filled with millions and millions of bacteria. They metabolize and cause breakdown of the bone at the end of the root, and that is called an abscess. So now what do we do? Well, we start by rubbing some topical gel around that area of the tooth to get the gums numb prior to anesthetizing it. Then we usually give 3 small injections around that tooth. We give you plenty of time to get numb. In a case where cold is a problem, we'll test the tooth to make sure you're not feeling anything. It's kind of like the old Gallo wine commercial. They said they would serve no wine before it's time. We do no root canals before you're numb, and we want to make sure that's the case. We want you comfortable. We want you relaxed. So the only difference between a filling and a root canal is this. This is a rubber dam, and as you can see, it fits right around the tooth. It gives me a sterile field in which to work. You wear it like a little mask. And that's the only difference that that you'll find between a filling or a crown and a root canal. Now, once we have that, then I access the tooth through the top of the tooth. We make a little access through the top of the crown or the tooth, and then we have access to the pulp system, the root canal system. It's like a little cave system where we have to clean all the tissue out, disinfect it, dry it, and then we're going to put a filling down to the end of the root. Now, this whole procedure, once you're numb, takes about 45 minutes for a molar tooth, shorter for any other tooth. But when we take the final x-ray, the tooth, you'll see white lines down the tooth, and that's your root canal filling. So now if you had hot or cold sensitivity as your chief complaint, that will be gone forever in this tooth because we've removed the pulp tissue. Teeth that have had infection, we may opt to put medicine in for a week or two before we get to this stage and fill it. So it may be a 2-appointment procedure. I'm the tooth whisperer. I listen to the tooth tells me what to do. If it's really infected, we're going to put some medicine in there and give you and your tooth the best prognosis. Now, after we're done, we like to wait 1 or 2 weeks before you see your general dentist. And if you have any symptoms or problems with the tooth, we want you to call us because we want to see you. There may be a problem and we need to address it. But if it's feeling fine, you make your appointment. We like to have the crown or the permanent restoration completed within a month. 1 to 4 weeks is a good window to get the permanent restoration done. And that's pretty much it. It's a very easy procedure. We are We like to call ourselves the firemen or the fire department of dentistry because most of our patients present in pain, and we understand that, and we appreciate that, and we will take very, very good care of you. Thank you.